First of all, thank you to Wani and Ili for having us to share your experience for practical session. Thank you for having us for this interview.
Alright, okay. So, before we start our sharing session, first of all, we would like to introduce ourselves as a panel. My name is Ahmad Asif bin Muhammad Shukri. I am from Group A1 and from Hospital Shah Alam.
My name is Hafiz Jaluddin, and previously I practical with our guest at HSAJB.
Hi, I am Nik Nurul Farah. I am from Group B2 and supposedly practical at Hospital Shah Alam.
Hi, my name is Hazwani binti Rosman. Currently, I am having my hospital training at Hospital Sana Aminah Johor Bahru and KK Mahmudiah.
Hi, my name is Ili Ayuni binti Salfan. Currently having my internship at KKSI, Klinik Kesihatan Sultan Ismail.
Proceed to our first agenda, which is the questions that we would like to ask. Alright, so the first question is for Azwani. What do you like about working in the hospital pharmacy?
Firstly, I love working in hospital pharmacy because I can gain more knowledge during my hospital training. For example, I earn some tips and tricks from the staff for external and internal preparation such as aqueous cream and sildenafil syrup.
I would say that it is the best to work under the hospital pharmacy as you are always busy and no time to waste because of the close. And here your job as a pharmacy assistant is to prepare the medication to the patient. And as a pharmacy assistant, you are the backbone of the pharmacy to allow the pharmacy setting work smoothly and organized.
Alright, thank you, Ili. Moving on to the next question, which is from Hafiz.
Okay, so the next question is for Hazwani back. Could you tell us which department that you had been attached is the most you like?
I've been attached at OPD, IPD, TPN, CDR, and store. But the most department that I like is IPD and TPN. This is because the staff is really kind and helpful, so that I can gain more knowledge during my training and attachment. For example, I can see clearly and do how they make the TPN bag and the antibiotic for TPN attachment. And then for IPD, mostly I can learn more about the internal preparation. So this is why I like IPD the most. The staff is really kind and helpful, so that I get more knowledge from them.
Okay, thank you.
From all of the department I attached, I choose manufacturing department because I got the chance to compound and produce internal and external preparation or production. For example, syrup omeprazole, syrup morphine, and aqueous cream. So this kind of experience is quite rare.
Okay, for Hazwani, as you have learned most of the theories during the first 4 semester, from your opinion, what is the biggest difference between learning the theories and doing the practical at the hospital?
So in my opinion, I think that there is a huge difference between theory and practical. This is because during theory SEM, we have to follow the rules and follow the lecturers for the answer and fact, right? So when we go to hospital training, there is no answer for each everything that we did. So there is no or yes for everything that we did. There is this can be this way, that way, or another way. So I think that practical helps us to understand theory better, and theory helps us to make a better flow during our practical.
What about Ili?
In my opinion, I think that theory you only get the knowledge based on the secondary sources. So you only get the idea, but when you go to for the practical, you experience it on your own. You get the hands-on. So I think that knowledge, theory and practical is two different things. From the knowledge, you only get the surface, but knowledge, theory combined with practical, you get the whole idea. You get the experience, and also you understand tips about what you learn.
Yeah. So the next question is, are there any mistake that you had done during the practical session? What have you learned from the mistake?
During my attachment at OPD, outpatient pharmacy, the mistake that I always did is for mistakes such as look alike and sound alike. And at first I didn't know how to calculate the insulin, but after 1 month having my practical at OPD, I got some tips on how to calculate the insulin and so on. So I learned that we must to focus during our filling session, so that there will be no mistake for the pharmacist to check. Cepatlah Ili jawab.
Okay, sorry. Okay, really like Hazwani, during my early attachment at OPD, I'm quite familiar with the medication. So I usually feel wrong medication as it looks alike and sound alike. So the things that I learned from here is you need to ask your senior and stay focused during your work, which is when you ask your senior, they have the tips to minimize common error.
Moving on to the next question. Throughout your practical session, is there any situation where you went above and beyond what was expected? Hazwani.
I think that situation that I have been experienced beyond my expectation is when I am having my attachment at CDR. So that my hospital, my clean room for CDR hospital is already broken, so that we need to travel to HSI to reconstitute our drug for hematology ward. So there was one day that we went to HSI, and then after arrive at HSI, we just know that there was no electric, so that we have to go back to HSA and do another reconstitute drug using fasil. Betul kan? Kita guna fasil kan?
Betul.
Okay, betul lah.
Alright, thank you Hazwani. Okay, so for Ili,
Wait, aku rasa aku tak ada jawapan untuk soalan ni sebab aku rasa macam jawapan aku sama dengan Wani.
tak nak tanya nombor 6.
Okay.
So, for Ili, throughout your practical duration, do you ever have experience working with patient, and how does it feel when working with patient?
Actually, as an intern, as a pharmacy assistant, we don't involve in dispensing medication or doing the counselling to the patient. So we just serve to fill the medication only. But from here, we prepare good and right medication to the patient. So even though it is quite tiring and busy, but it's satisfying to serve for the patient and the pharmacist.
Cerita PSY.
Lah ini
Balik. Biasa malu lah pelik-pelik lah.
cleaner.
Aku rasa kau selayaknya.
Wah.
Istilah cleaner.
Wah.
Pengalaman kau lagi menarik.
Okay.
PSI tu apa?
PSY, secretary.
Oh. Yang akan Gangnam.
Gangnam Style.
Open Gangnam Style.
Ni boleh ikut tanya kelas sekali.
What are your biggest accomplishment and why are those a big deal for you?
My biggest accomplishment during my hospital training is that during OPD attachment where we all need to survive and fill the medication alone. So after 2 or 3 weeks, we get to fill 5 to 8 prescription at one time. So they will be bakul tu macam banyak gila lah. Oh, tu cakap VM pula.
My biggest achievement is I learned how to communicate well and learn to adapt with a fast-paced environment like at OPD. And it's because for me it's not easy to multitask things while ensuring you minimize the error.
Could you tell us more about the workflow of working in IPD department?
So working in IPD is an easy task. So first, easy and busy. So firstly, when we arrive at hospital at at 8 a.m. we have to breakfast, and then after breakfast, the assistant pharmacy or the staff will print the indent or the indent medication from wards in the PHIS system, and then at 8:80 we start to supply for floor stock for wards, and then we will stop at 10 usually. So at 10 we will start to supply medication for the patient at the ward. There is three section that we need to supply. Tablet, which is for cassette trolley, and then the injection. The injection we will supply for what with trolley first and the cassette. So during the COVID, in this pandemic, the IPD at new wards, so they will be more prescription that we need to supply. So we have to stop at 1 p.m. usually, 1 p.m. sharp, and then we went to recess at 2 p.m. we will start to supply again for the afternoon session for those patient yang for those new patient, for those new admitted for those new admit patient. And then stop at 5. Then we go back.
Thank you, Hazwani. So, aside from workflow, what are the medicines that are usually dispensed at the IPD department?
Usually we will supply injection, which is antibiotic injection, such as Augmentin injection, Tazocin, Unacin, Meropenem, and recently there are huge. We need to supply more. Benda warna kuning tu ah? Oh, enoxaparin injection for COVID patient.
Wow.
Tu je selalu. Oh, dengan ni. Kalau sama-sama. For PITS, we need to supply sildenafil syrup and omeprazole suspension.
And the last question for IPD department is, what are the precaution or tips to survive in IPD department?
Tips to survive in IPD is that we need to recognize more with the medication, and focus on the dose given by the doctor.
So Ili, can you tell us how the workflow at outpatient department?
Okay, first, as pharmacy assistant, we receive the prescription from the patient, and then we will try to interpret the prescription, what the medication are ordered by the doctor, and then we will fill the medication according to the frequency and the dose of the medication. Then we will pass the we will pass the okay. Then we will pass the medication to the pharmacy in charge for the PHIS system, and then they will make the label. PHIS mean pharmacy information system, and then they will label the medication and dispense it to the patient. That's the workflow at the OPD.
Okay, thank you. So next is, can you give us a few examples of the medicines that are dispensed at outpatient?
Okay, so basically, at OPD, there are 3 types of counter which serve different medication. For the counter 4, we serve for acute pain medication such as tramadol. For counter 6, we serve for the chronic disease like diabetes. For example of the medication is metformin. And then for the last counter is for the critical disease like HIV and AIDS. So example of this, the medication is tenofovir and efavirenz.
Skin disease, huh?
Oh, skin disease.
Hello, orang dah habis.
Okay.
What are the survival and survival tips that you can give us for OPD department?
I would say that for you to survive at outpatient department, you need to ask your senior about everything. If you unconfirmed about something, just ask. Don't remain silent and don't assume, because it can lead to medication error.
Okay, Hazwani, could you tell the workflow for the manufacturing department?
So the workflow of manufacturing department, basically there is another sub for manufacturing, which is sterile and non-sterile. For manufacturing, sterile manufacturing, there is TPN and CDR. So kalau or if we went through for the TPN, sterile preparation, sterile manufacturing. So in the morning, we usually receive the indent from the wards for peds and adult for TPN, and then we will receive indent for CVAS, which is antibiotic constitution for antibiotic and heparin saline, and then they need to send their indent before 10 a.m. so that we need after 10 we need to calculate the total medication that we need to bring to the clean room, and then after that at 12 usually we will go into the clean room and prepare ourselves at 12 p.m. and then we will go in the clean room, prepare ourselves by wearing the PPE and washing hand, all that, and then usually we will went out after 3 or 4 usually, and then after that we will call the ward to get their medication to supply for their patient. Then for manufacturing, non-sterile manufacturing, there is pre-packing and external preparation. So we usually supply in the morning for floor stock ward. So and then we have to exchange basis such as chlorhexidine and Septisol, which is hand sanitizer. Then supply their floor stock, and for some ward we need to make a extemporaneous preparation, which is chlorhexidine 2% in aqueous. Then in the afternoon or evening we will do external preparation such as aqueous cream, or betamethasone cream. That's it.
So, what are the most frequent preparation at the manufacturing department?
Ili jawab.
Oh, okay. At manufacturing department, we have two kind of preparation, which is internal and external preparation. For internal preparation, we usually prepare for omeprazole syrup, and usually it will be done from the IPD, OPD, and maybe from the other health clinics. And also, we prepare external preparation like aqueous cream.
Okay, last question. So, between both of you, could you share with us several tips on how to survive at the manufacturing department?
Several tips that we need to have before having our attachment at manufacturing is that we have to know about the step and follow the step according to their master formula, or else the final result for the compound will be broken.
Okay, so we have come to the end of our interview session. So we would like to thank Hazwani and Ili for we would like to thank Hazwani and Ili for joining us this evening, and we pray for your success in practical session, and also pray for our clinical session too. And that's all from us. Thank you. Wallahu a'lam. Assalamualaikum warahmatullahi wabarakatuh.